Hey, Remar nurses, this is the 1 week countdown. We are literally 1 week away from Black Friday, the free NCLEX review. It's happening. Are you signed up for it? Right now, we're about to get into some NCLEX style questions to help prepare us for this big event. So here's the first one. I'm getting right into it. I want to see answers on the screen. We are going with this. The charge nurse working on a medical unit night shift is concerned that the float nurse is smoking marijuana on duty. On more than 2 occasions, the charge nurse has smelled marijuana when the float nurse arrives for night shift. Which action should the charge nurse implement first? 1, confront the float with the suspicion. 2, talk with the night supervisor about the concerns. 3, ignore the situation unless the nurse cannot do her job. Or 4, ask to speak to the hospital ethics committee about the problem. I want to see answers on the screen. This is management of care. This is management of care. So not what you would do personally, but what should the charge nurse do? Now, many of you have never been charge nurses before, but you need to know protocol. So you have a charge nurse working on a medical unit, and she believes that her coworker, a float nurse, is smoking marijuana. Now, she says this on more than 2 occasions. She has smelled marijuana when that nurse comes to the unit. What is the best thing? Or what's the first thing? That's what the question says. What is the first thing? Number 1, confront the float nurse with suspicions. I want to see comments on the screen. I also want to know why you think your answer is right. So confront the float nurse with the suspicions. Talk with the night supervisor about the concerns. Ignore the situation unless the nurse cannot do her job. Or 4, ask to speak to the hospital ethics committee about it. Yeah, ask to speak to the hospital ethics committee about it. Correct answer. I see your comments on the screen. Welcome. We're studying right now. Yeah. 2, talk with the night supervisor about the concerns, because this is what it is, guys. The night supervisor or the unit manager, they are the ones who have the authority. They are the ones, the chain of command. I like that comment, to require that nurse to submit to a drug screening. It can be done, right? Employee health, they do them all the time. So in this case, the night supervisor needs to handle the situation, not the charge nurse. Now, the charge nurse has to report the behavior. They have to report the behavior, but they are never to, number 1, confront. Yes. They are never to confront it. I like this comment. If the nurse addressed it directly and confronted, that's a terrible word. You never want to pick that. Then that float nurse might have been defensive and argumentative. That's so true, because they'll say, you're a worker just like me. Don't ask me about my job. It happens all the time. You guys know how it can go down. So the best thing is to have that night supervisor address the issue. Okay, let's try another one. Here we go. Question number 2. These are more management of care. Yeah, these are more management of care today. So a new graduate registered nurse is working with an unlicensed assistive personnel who has been an employee of the hospital for 21 years. However, tasks delegated to the UAP, by the registered nurse are frequently not completed. Which action should the graduate nurse take first? Okay, so this is right up your alley here. Number 1, tell the charge nurse the UAP is insubordinate. 2, create a written list of assigned tasks to help emphasize their importance. 3, complete the delegated tasks as the registered nurse. Remains responsibility. 4, discuss with the UAP why the delegated tasks are left incomplete. Oh, I see the answers coming on the screen. Welcome, welcome, welcome. I see some people that I know. And I'm so happy that you guys are here because I know you're testing soon. So this is right up the alley. This honestly is a common scenario for NCLEX as well as in real life. You have a new nurse, you're fresh, you're young, you're coming in, and you will be delegating tasks to nurses' aides who have been there for 10, 20 years. And the nurses' aides are not doing the tasks that you asked them to do. It's a real problem. Some of you guys know exactly what I'm talking about. It's tough. And so you can expect these kind of scenarios on the NCLEX exam. What are you supposed to do if you tell somebody who is supposed to be under you to do something and they don't do it? LaWanda, I got to stop and spotlight you. I just want to let you know that I'm a remar. Okay, I like that. I passed the NCLEX, took the test Tuesday, got my results yesterday. Amazing, phenomenal. I love it. Congratulations, Miss Miles, Nurse Miles. You did it. That's what I want for everybody. Thank you for coming and showing us that you are a remar. I love it. So what do you do? I see a lot of people are switching their answers. That's fine. After thinking about it, reading some of the comments, everybody should be choosing number. Let me make sure we're all together. Yeah, everybody should be choosing this one. Number 4. And this is probably the toughest one to do. Why is number 4 so tough? Discussing with the UAP why the tasks are left undelegated. So I'll just say this. I'll just stay here. I'll just say this too. And I got another testimonial. I see it. I'm trying to get to the comments. There's a lot of them. But congratulations, Gloria. I am proud of you too on your first attempt. That is phenomenal. Remar all the way. Congratulations. Say congratulations to my girl, Gloria. Okay, so I put here, the graduate nurse should handle the situation directly before notifying the charge nurse. Ooh, if you go and tell the charge nurse on somebody without speaking to them as a new nurse, problems. The other option says a written list may be helpful, but you don't want to go out handing Christmas lists to your coworkers about what you want to get done. Like, that's not going to be the first step. The graduate nurse must address the insubordination with the UAP. And that's the toughest. That is the toughest thing to do. What's easier and what most new nurses typically do in real life is number 3. And that's just complete the tasks that are not getting done. And so you get into the issue of trying to do your work and trying to do somebody else's work because you don't want to have that difficult conversation. But there may be a benefit in it. When I had this situation and I asked the UAP why they weren't doing it, I got 2 responses. One of them said, you don't tell me what to do, right? I was in this exact same situation. The UAP said, you don't tell me what to do. All right. So she had a personal issue with me. So I did actually have to address that with my unit manager, who told her, yes, Regina does tell you what to do. The second thing was the other UAP said, I have so much stuff to do. I just don't get around to it. So that's a different thing. We had to work together as a team. But you definitely must go to that person directly. Okay. You have to go to the UAP directly as a nurse, because if you don't, it's going to be a bigger issue. The issue is just going to keep growing. So you want to dead it as soon as possible. All right. Good job, everybody. I think everybody got that one, or you guys are following me. Let's try another one. 3. Here's another one. This is management of care. The charge nurse informs the nursing house supervisor that one of the registered nurses is falsifying vital signs. Which action should the nursing house supervisor or supervision implement first. All right. Y'all got the scenario. Number 1, inform the unit manager of the nurse about the situation of falsifying vital signs. Okay. Take the assigned client's vital signs and compare with the RN documentation. 3, bring both parties together and discuss the situation in a neutral environment. 4, document the incident in the registered nurse's employee file. Oh, now what is the first thing this nursing house supervisor should do? Because you have a report given to you from the charge nurse. So now what? So the charge nurse tells the nursing house supervisor, what is the action? Yeah, I see. And you guys are all on one accord. You know, I love when y'all are all on one accord. I really do, because that means that this is a community issue that you guys are strong at figuring out. And so pretty much everybody's picking the same thing. Okay. And let me tell you guys, I actually, I agree with you. Taking that assigned client's vital signs and then comparing it with the RN is going to be validating over the report that the charge nurse gives. Now, not saying that the charge nurse can't be trusted, but as somebody that's going to move forward with possible punishment, you want to make sure that you have the information for yourself, because you don't know what kind of relationship the charge nurse has with that registered nurse. So you just want to make sure that the information is verified. So this is what would happen. All right. 3, nobody picked 3, but just understand this would not be an issue that we would have both parties come together and try to work out. If the charge nurse accuses another staff person of drug abuse, falsifying documentation, stealing, that is not a 2 individual, let's work it out together. All right. There's action that has to be taken. So getting together and doing a powwow is not that thing. All right. It's not that thing, especially not first. So number 2 is the correct answer in this situation. And we are studying management of care. This is all because next Friday at 12 p.m. Eastern time begins our free Black Friday NCLEX review. It's a 4-hour NCLEX review. And so I definitely want you guys to get in right now. Sign up for it. remarnurse.com/BF. Shout out to Cara. She says, I encourage all to purchase the virtual trainer along with the Quick Facts book. It's amazing. Passed on my first try. I felt confident and knowledgeable. Thanks, Regina. And you guys, the Remar family. Thank you so much. Did you tell me if you're an RN or a PN? Let me know. Let me know, Cara. All right. Next question. We are moving on. Oh, this is a good one. The nurse hung the wrong intravenous cardiac medication for the coronary bypass client. Which intervention should the nurse implement first? All right. Is it number 1, assess the client for any adverse reactions? 2, complete the incident or adverse occurrence report. 3, administer the correct intravenous cardiac medication. Or 4, notify the client's healthcare provider. Oh, and this is one of those ones that I'm happy that I'm doing, because what's happening is we are getting different answers. We're getting different answers. And so this is showing me that, hey, this is a topic we need to cover. We need to go over this. So what should you do? What should you do here? We have a nurse and they have given the wrong medication. So what's the first thing to do? Should we call? Because this looks like it's between 1 and 4. Should we assess the client for any adverse reactions, or do we need to call notify the healthcare provider first. What say if you guys notify the healthcare provider first? A lot of people are saying that one. A lot of people are saying 1, 2. So if and when you get this scenario on NCLEX, because it's probably possible that it's coming, the correct answer for you to do is going to be, you need to assess the client before you call anybody, right? That's what you need to do. Because what happens is the nurse will need information to tell the healthcare provider. If you don't assess the client, you're basically calling the doctor to say, I messed up. You're basically calling to say, you know what? I read the order wrong. I ignored all the safety issues that the electronic MAR was telling me. I overrode them and I just gave the medication. And the doctor's going to be like, what's my client doing? What's the patient doing? Where are they? How do they feel? And if you have not assessed that patient for any adverse reactions, that doctor is going to be irate. They're going to be very angry because you're calling them now to just have a general conversation about you. And it's not about you. It's not about you giving the wrong medication. It's about what is happening to the patient under your care. All right. So new nurses, they make this, they do it a lot because it is about them, right? We're so focused on doing certain tasks and completing our work, but really, guys, it's about the patient. And you have to be able to demonstrate that on the NCLEX, that you're putting the patient first. So what you need to do here is assess the patient, okay, before you call the doctor. Assess before you call. Question number 5, the registered nurse has just received report on 4 clients awaiting to be admitted to the pediatric unit. Which client should be assigned to the LPN? Okay. Which client should be assigned to the LPN? So this is a little delegation management of care. Here we go. Is it number 1, the 11-year-old diagnosed with acute sepsis? 2, the 15-year-old client diagnosed with systemic inflammation response syndrome? 3, the 8-year-old client diagnosed with poisoning? Or 4, it says here, the 7-year-old client diagnosed with diabetes mellitus and type 1. It seems like type 1 got cut off, but it's diabetes mellitus type 1. So which client out of these 4 should be given to the LPN? Is it the 11-year-old with acute sepsis, 15-year-old with systemic inflammation response syndrome? We have a 3-year-old with poisoning, or we have a 7-year-old diagnosed with diabetes mellitus type 1. And again, look at my answers. They are all very, okay. So you guys are thinking either the poisoning or you're thinking, looks like number 4. Okay. Now remember, what do we know? What do we know about the LVN? What kind of patients do we seek to give the LVN or the LPN, depending on where you are? Okay. The licensed practical nurse, when they get their nursing education, they primarily focus on doing skills. I love it. If you don't know, you don't know. All right. So the LPN, the LVN, they typically focus on doing skills. And so we like to give them patients, I like that, Ann, stable patients with predictable outcomes. We like to give the most stable patients. So when you are getting these kind of questions on your NCLEX exam, they should not be difficult. They should not be difficult for you if you know that, if you have that parameter in your mind, okay? Because we can look and we can see, okay, which patient is going to have a need for assessment, is going to have the need for rapid care, is going to have the need for probably some emergency situations or interventions. Because if a patient has a need for any of those things, I cannot give that patient to a LPN, right? And it's not that the LPN is not a great nurse, because I know some LPNs that are better than a ton of RNs. It is just the fact that they won't be able to carry out certain orders. So let's just go down through these patients and let's talk about what kind of care. Let's anticipate the kind of care that they might need. So some of you guys picked number 1, the 11-year-old client diagnosed with acute sepsis. Now, we're trying to give this LPN, I should say. I'm thinking California. California calls them LVNs. So we're trying to give this LPN a stable patient with predictable outcomes, because that's what you guys said, right? So if I have a patient with acute sepsis, is that a stable patient? Absolutely no. Would you give this patient to an LPN? No, because they have an acute condition, which means it just came on, it just happened. And then sepsis, what does sepsis mean? It means the person is completely toxic. It means they have toxicity in their bloodstream, right? It's an emergent condition. I like that. That's why I want to see the comments. You guys help me to explain it when I can't find the words. This patient is absolutely unstable. Absolutely. All right. And the doctor might order IV fluid. I don't know. Who knows? The blood pressure might drop. I might have to give dopamine. If I'm an LPN, I cannot do it. And absolutely, this patient needs a ton of assessment, a ton of rapid assessment. So can't give this patient to an LPN. Number 2 is 15-year-old client diagnosed with systemic inflammation response syndrome. Does this sound like an appropriate patient for the LPN? And that answer would again be no. Patient has a systemic issue. That means it's affecting what? If somebody has a systemic issue, that means it's affecting every organ. It's affecting the circulation, and there is a response. There's an inflammatory response to some condition, right? And so this patient as well is going to need rapid treatments. This patient is going to need that assessment. So we can't have the LPN doing it. And I'm stopping here trying to go through it because I want you guys to have the same kind of mind frame when it's just you alone by yourself in front of that test exam. You have to be able to talk your way through this. All right. So number 3 is an 8-year-old, and these are all pediatric clients. So you have an 8-year-old, and just thinking in general, sometimes pediatric clients, even though typically they are more apt to health, right? They don't have chronic conditions, but sometimes they have less ability to compensate. So we have an 8-year-old client, and they're diagnosed with poisoning. We don't know what type of poisoning. We just know that they have ingested some poison. So can I give this LPN number 3? A lot of people pick number 3 because you thought, oh, poisoning, I know what it is. It's just a poison. I mean, but we don't know. Is this rat poison? Is this Clorox? Is this Tylenol overdose, right? And even if it was either of those 3 things that I just said, this patient is going to need what that the LPN cannot do. They're going to need the assessment, right? They're going to need probably, I don't know, the doctor could order gastric lavage. I don't know what could happen. And so I cannot give this patient to the LPN. Yes, they're going to need close observation. The parents are probably going to be, up in arms, and it's just going to be a changing situation. So we cannot give this patient to the LPN. All right. So you guys that are following me, I'm staying here for the ones who didn't get it right. Okay. So we're slowing down the teaching just for the ones who didn't get it right, because this is one of those things that if you get this one wrong on your NCLEX exam, it's a safety concern. Okay. It's a safety concern. It shows that you're not going to be making safe choices. All right. So I want to make sure we all get this one right. Number 4, the 7-year-old, of course, is the correct answer because this patient has a diabetes mellitus type 1, I said it was. So diabetes mellitus type 1, is it a serious condition? Absolutely, right? We would not want to, we wouldn't want to, just make light of it, but we're looking at it in the scope of the other 3 patients. And when I look at it compared to the other 3 patients, because that's what you do for NCLEX, you're just picking the best answers from what's in front of you. So when I'm looking at number 4, compared to poisoning, systemic inflammation response syndrome, and acute sepsis, this is the one that is the most stable, right? And it has the predictable outcome. If the patient's blood sugar is high, if I administer insulin, it will go down. If the patient's blood sugar is low, and if I administer glucagon, it will go up. So this is why this is going to be, I'm sorry to have it here. This is why this is going to be the correct answer. Number 4 is the correct answer. All right, I don't want to rush it. So, okay, are we all clear? If we're now clear, we can go back and look at it, but we will have questions like this. We will have questions like this on Black Friday NCLEX review. I was looking at them last night, tons of questions like this. So I want you guys to get ready for that. Let's move on to this scenario here. This is another one that I got to make sure that you guys are reading and answering correctly. So a mother calls into the wellness center and states that her 7-year-old daughter has been stung by a honeybee. The nurse is on the phone to give advice to the situation. Which action should the nurse tell the mother to perform first? Okay. Is it number 1, administer diphenhydramine to reduce allergic response? 2, hang up the phone and dial 911. 3, take the child's temperature and monitor respirations. Or 4, remove the stinger by scraping the skin. So the scenario is you have a mother, she's calling on the phone. She's calling on the phone saying, my daughter's been stung by a bee. This may have been her daughter's first time being stung by a bee. I don't know, but she's calling in for advice. What should the nurse tell the mother to do first? Okay. And I love it. I love it. The answers are coming in. Tag this video because we are talking about some scenarios that you guys may have not thought of. So tag your friends in this video. Also share this video because these are the situations that break your confidence during the exam, or if you know them and you know what to pick, you get a sigh of relief and say, whew, so glad I showed up and Remar went over this with me. Thank God I did that, right? So I want this video to get out because this is, I don't know if this is a specific question we do for Black Friday. I actually don't think it is. So the best thing, and I see I'm going to have to go through all of these again with you guys, but that's fine. The best thing for the mother to do, guys, the best thing for the mother to do in this situation, okay? Oh my goodness. The best thing for the mother to do in this situation, let me just show you guys, is going to be number 4. It's going to be number 4. That is the best thing for the mother to do. Why is number 4 correct? Because it directly removes the thing that could be causing any issues. So if you get stung by a bee, because that's what happened, and so a lot of this, let me say this, a lot of passing NCLEX is reading. It's reading. It's not jumping to conclusions. It's not making up your own scenarios. It's literally reading is fundamental. So a lot of people just went with assessment. I know assessment is always right. I know it's always right. I know it's always right. No, assessment is not always right. It's good. It's great. In some situations it's right, but other situations, it doesn't make sense. Okay. And this is one of those ones. So if we take the stinger out, we're going to further reduce exposure to the venom. Okay. So this is the priority action of the nurse. After that, then giving ice, pain medication. If you see an allergic response, then that teaching can be done. You call 911 if that's appropriate, but that might not always be appropriate. Okay. And so these are the kind of questions that trip people up all the time, right? And students will say, I know the content. I know the content. I don't know why I failed NCLEX. What do I need to do? A lot of the time, my answer is really simple. You need to learn how to read. You need to learn how to read and learn how to read without bias, right? We need to learn how to read without bias, without adding our own little to it. Yeah, right? And so this is one of those scenarios. And some people, I didn't know that that's how you remove it. Okay. Oh, you thought it was a distractor. I got it. All right. So, I'm planning the Black Friday review for your benefit. Okay. So if you don't have the virtual trainer, you're definitely going to get a sneak peek into it because there's a lot of that in the VT. Okay. Do I have another one? For you? Oh yeah. Okay. Let's do it. I don't want to keep you guys long. We've actually been studying. We've actually been studying for about 30 minutes. So I am so happy that you guys showed up on this random Friday, right? Because usually I don't go live on Fridays. So this is special for you. But we have a 1 week countdown. Sign up to the NCLEX review. Also, it was mentioned before, but I am giving a $100 gift card away to somebody who signs up. So go ahead and do it. Somebody that signs up before, what day is it? Somebody's gonna get a $100 gift card. Okay, let me do this next question. All right. So number 7 is this. Can you guys see it? I think you can. All right. The nurse is discharging a runaway prostitute who was treated for bruises by her significant other. What is the priority intervention for this client? Okay, you got the scenario. Number 1, educating the client on when to call the police and providing the contact number. Okay. 2, setting up placement at a safe house. 3, setting up a referral to social services. 4, investigating the client's plan for alternative employment opportunities. Okay. Okay, this is another one where I see some division. And I won't. I'll just let the comments flow in. You guys are feeling comfortable. So get your comments on the screen. This is a good scenario because you got a lot going on here, right? This is not your typical 65-year-old patient with acute renal failure. So what is the priority here? Lots of different answers. So we're going to talk about it. Okay. The correct answer for this situation is going to be, you got it. A lot of you guys got this one. You weren't distracted. It is going to be setting up placement at a safe house. This is safety. Clients who are involved in domestic violence situations, they need to be placed in a safe house or a shelter immediately to ensure their safety. The nurse should advise the client not to return to where the violence is likely to occur, right? She needs safety now. Yes, absolutely. The other interventions are managing a safe environment. So we cannot talk about, you getting a different job. We cannot talk about, here is the contact number for the police. We cannot talk about, what else was it? Social services, Meals on Wheels, clothes, food stamps. We cannot talk about any of that if the patient is not safe first. So I threw in there, this person was a runaway, a prostitute, because I wanted to know if I could get you to forget her priority. Because when you, and this is why NCLEX has to change. because it's easy for us to get so distracted by social situations or social environments that we forget the medical priority. All right. And that's just us as people, that everybody can struggle with that. And so we have to be able to change the NCLEX exam to address these types of situations. Because honestly, right now the NCLEX is very vanilla, right? And I say that, and that's my new word. That means that it's very uniform. We're talking mostly acute care patients with diabetes, renal failure, COPD. We are not really talking in depth about the prostitutes, about the heroin addicts, right? About mental health issues, about domestic violence. We need more of that on the NCLEX exam, because that is the society we live in. That's the society we live in. So that's another conversation. This, though, is the pre-Black Friday NCLEX review. And we're going to look at scenarios like that. If you haven't signed up for it, it actually takes place the Friday after Thanksgiving. So 12 p.m. to 4 p.m. after Thanksgiving. This is a 4-hour free NCLEX review. I'm going to go over basic care and comfort. I'm going to go over orthopedics. We're going to talk about that quick facts book that everybody should be studying. You should have it. IV therapy, pain management, diets. I got practice questions just like this one, and so much more. And so the workbook is coming Monday. So if you are not registered, right? If you're not registered, you need to get on board, because people who register are going to have access to the Black Friday pricing first. And this is a while supplies last opportunity. So for example, the quick facts book regularly is $39.50. Sometimes I drop the price down to $37. However, for Black Friday, it will be $20 holla. All right. So I want to make sure that you're able to get that. Also, if you're a pre-nursing student, or if you are trying to get into nursing school, you got to take that quick facts TEAS, or you got to get that quick facts for TEAS or HESI, because you got to take that exam to get into most nursing schools. So I have a quick facts for that. I want to help you get successful on that exam so you can get into the school of your dreams. And the big Black Friday ticket is all of you who will be taking advantage of the virtual trainer sale. All right. And the virtual trainer sale this Black Friday, we doubled what we usually take off is $100. We doubled that price. So we'll be taking off $200 from the virtual trainer. And that is my physical books, my online NCLEX review. You can watch it on your tablet, your phone, and it is going to get you prepared for your exam. So on Black Friday, it will be $169, and that's for everything. That's for 90 days, 3 months access, you guys, into this program. It's only going to take you 6 weeks. Some people do my program in 4 weeks, but on Black Friday, it will be just $169. However, if you sign up at remarnurse.com/BF, you will get early access to this. And the reason why that's so important is because you don't want to be jammed up in the rush of Black Friday shipping, okay? Everybody will be trying to ship things out. USPS, they get overwhelmed. They start losing stuff. It get crazy during Black Friday. So I want you guys to have early access so you can purchase this. And by the time Friday comes, you actually have the workbook and you will be ready for me to let's go. We're going to be ready to study. So also, again, I will be doing the $100 Visa gift card for one person who signs up for the early access. All right. Okay, guys. So this is where it's at. Go to remarnurse.com/BF. We are 1 week away. We are 1 week away from this event. We are 1 week away from this event. Also, I wanted to spotlight the study calendar is going to be pivotal. We literally just have a few weeks left in the year. So I want you guys to be able to get the virtual trainer, get your NCLEX study calendar, and also I want you to use it every day. I want you to be able to pass the entire virtual trainer NCLEX, because my NCLEX review is all about getting you there. So you're going to have a lot of those questions like we did today. I want you to be able to pass every exam in the virtual trainer, and I want you to be able to finish in 4 to 6 weeks. I'm saying 4. I'm going to challenge you guys, because the daily study calendar, it has rest days in it. I want to challenge you guys to finish in 6 weeks or sooner if you want to add an extra study day. So let's go. Let's do this. We are 7 days away. The Black Friday NCLEX review, all access pass to the virtual trainer is happening. Jump off here, sign up for it, enter to win $100 Visa gift card, remarnurse.com/Black Friday. 7 days away from this event. Don't miss. This is your opportunity to jump start your NCLEX review with me. I'll be right here waiting for you guys. remarnurse.com. If you need help, Team Remar is waiting to help you. If you need to sign up, we can help you sign up for it as well. If you don't know how to get to this website, we can help you. Just let us know. Hit us up on Facebook Messenger, and we will get you signed up. Or you can also email me, support@remarreview.com as well. All right, guys, have a great weekend. I will see you soon. Make sure you share this video out so everybody can get signed up. Also, click the link for sign up. We'll put it in the comments. You just click the link and it'll get you there. All right. I'm saying congratulations. To you guys in advance. Because the goal is for you to pass NCLEX. You can, you will, and you must pass NCLEX.